Hello everyone. So today I want to talk to you about vasopressors. This is specifically for cath lab nurses, cardiac nurses as well, but this is specifically for my cath lab nurses. Vasopressors, right? So vasopressors are class of medication that causes vasoconstriction. The reason why you would consider vasopressors is, of course, if you need to increase the blood pressure, also blood pressure slash aortic pressure, right? If you're in the cath lab, you have AO pressures as well. If you need to increase the mean arterial pressure, if it's, let's say it's less than 65 and you want to bump it up, definitely want to, apart from fluids, if they can handle fluids, is you want to start thinking, okay, vasopressors, let's grab this, let's suggest this to the doctor, okay? And then you see on the right side are some choices of vasopressors that are commonly used, and I'll talk to you about why we would choose each one apart from the other. But before we dive into that, okay, we need to, first of all, when a patient's blood pressure drops, the first thing you should think about is, why is this patient hypotensive, right? Because depending on why their blood pressure drop, it kind of, depending on why the blood pressure drops, you'll know what next step to take, okay? Because once you answer that question, then you're able to choose the right medication. Right? Typically, when their blood pressure drops, the first thing the doctor will ask you, of course, is to open the fluids wide, if they can handle it, right? If their EF is good, if they can handle it, then we go ahead and open the fluids wide. But if not, they probably won't do that. They might just gear towards, they probably still, but not as much, but they will gear towards vasopressor, having you start a vasopressor medication, okay? So three main causes that you'll see for hypotension in the cath lab. Number one is vasodilation, right? So vasodilation, instead of vasoconstriction of the vessel, you'll have the vessel kind of open up, right? It vasodilates, okay? And that can lead to that can lead to hypotension, okay? Vasodilation can happen whether, let's say, you gave too much hydralazine or any other drug that was supposed to reduce the blood pressure. So let's say you started at a blood pressure of 200 over 139. I'm going high. And the doctor's like, hey, I want you to give 20 milligrams of hydralazine, and you gave hydralazine. Or let's say they gave nitro, and the nitro causes too much, right? Nitro causes vasodilation, and it led to the patient being hypotensive. So in this case, the heart may still be pumping well, right? But the issue is the vasodilation of the blood vessel. Okay, remember that. So vasodilation, heart is still pumping well. Okay, number two reason that hypotension can occur is due to cardiogenic shock. So with cardiogenic shock, just like the name, the heart pretty much is going into shock. So the heart is failing as a pump. The heart is not pumping well. So therefore, there's not enough blood. There's not enough blood being pushed through the bloodstream into the organs, right? So some signs of cardiogenic shock: your patient might become cool and clammy, the pulses tend to drop, altered mental status because they're not getting enough blood even to the brain, right? Because not enough blood is being pushed through the blood vessels to supply the tissue of the brain. They can complain of chest pain, shortness of breath is one. Rising lactate, you won't really know unless we check it. So just kind of pay attention to the cool, clammy skin, the weak pulses, altered mental status if they complain of chest pain as well, shortness of breath, okay? Number three reason that a patient can become hypotensive in the cardiac cath lab specifically, I mean, of course, on the floor as well, is a combination of both, right? So let's say they are in cardiogenic shock and they also have vasodilation going on. So vessels are the issue as well as the heart. So two things are playing a role in this: the blood vessel vasodilating, and then the heart is basically not pumping, it's kind of giving up, is going into cardiogenic shock, okay? So with that, we can now consider, right, whether it's one or the other. If it's vasodilation, okay, we want to focus on a vasopressin that is only, like, significantly going to focus on causing vasoconstriction of the blood vessel, okay? So there are two main receptors, right? There's beta 2 receptors, but that's mostly found in the lung. But I just want to focus on the alpha 1 receptors and the beta 1 receptors, right? So, alpha 1 receptors, you will see it in the smooth muscle cell of the middle lining of your blood vessel. Okay, so your tunica media, right? That muscle layer, that smooth muscle layer of your blood vessel, alpha 1 receptors, right? So whatever medication kind of binds to alpha 1 receptors is going to activate those receptors and cause it to vasoconstrict, okay? And then we have beta 1 receptors. So these are found in heart muscle. So any medication that activates or stimulates beta 1 receptors is going to cause the heart to pump. The heart's going to pump better, right? And it's also going to increase the heart rate because the heart's working harder as well, okay? So just a refresher, right? We need to know what's causing the hypotension, and then we need to know, once we know what's causing it, we have an idea as to what medication that we're going to use. Okay, so the first medication I want to talk about is phenylephrine. So you kind of see it on here. Phenylephrine, also known as Neo or Neosynphrin, but we know it as, I know it as Neo, I know it's phenylephrine. So if someone says either or, you should know they're talking about phenylephrine, right? So phenylephrine is going to actually bind to alpha 1 receptors. And remember what I said, if it's going to bind to alpha 1 receptors, its focus is on that blood vessel, is vasoconstricting the blood vessel, okay? It doesn't have the beta 1 cells, so it's not going to affect your heart muscle directly. It's going to focus on the vessel wall, the alpha 1 receptors, okay? And because it does that, right, it's going to go ahead and do that vasoconstriction that we need it to do, therefore increasing the patient's blood pressure. The next one we're going to talk about is norepinephrine, right here, also known as Levo. Levo, which is norepinephrine, right, stimulates both, but mainly alpha 1. So Levo is going to stimulate alpha 1 receptors as well as beta 1 receptors. Okay, so what does that mean? So you're going to see the benefit of vasoconstriction of the blood vessel, right? And then you're also going to see the benefit of, since it stimulates beta 1, it's going to cause the heart muscle to pump more, therefore increasing heart rate, okay? So if you start someone on Levo, before you start someone on Levo, pay attention to their heart rate, not just their blood pressure, okay? Because it can lead to, if someone's already tachycardic before Levo, right? Let's say they're hypotensive but tachycardic before Levo, it's going to make that tachycardia worse. It's going to increase that heart rate a bit more, but also give you that effect of increasing the blood pressure, okay? So that's why typically we consider, right? Levo is typically considered that first line of vasopressor for someone in cardiogenic shock. Okay, so if someone's in cardiogenic shock, we already talked about that, right? That heart is kind of giving up. It's not pumping as hard, right? We are going to start Levo. Levo is what you should be thinking about because it's going to help to increase the heart muscle, pumping of the heart muscle, right? Therefore, also increasing heart rate as well. Okay, the next one I want to talk about real quick is epinephrine. Epinephrine is another one, but epinephrine stimulates 3 receptors. You have alpha 1, beta 1, and beta 2. So I'm going to stop the video right here and I will do a part 2, just kind of continuing on the vasopressors, specifically the ones that you're going to see in the cardiac cath lab that they will ask you for. I hope this was helpful. If I missed anything, please share for all you guys with experience, add it to the comment section so everybody can be informed. See you in a bit for part 2.